Hi, everyone. This is Nurse Anna from nursestudy.net, and today we're going to be speaking about constipation and go over a couple nursing care plans.
This website is not intended to provide medical advice. The articles on this website are intended for entertainment or educational value only. While we strive to offer 100% accuracy, medical procedures are rapidly changing, and laws vary greatly from location.
Constipation is a medical condition characterized by infrequent bowel movements or difficult passage of stool or both. It is often defined as less than 3 normal bowel movements a week. It is a common complaint with an estimated prevalence of 12 to 19% of the population in America and about 27% in Canada. Constipation has several causes, which may include gastrointestinal disorders, neurological problems, post-surgical status, ongoing chemotherapy treatment, or even pregnancy. Its treatment process is often directed not only at addressing constipation, but on tackling the underlying cause. Some of the signs and symptoms would be passing fewer than 3 stools a week, having lumpy or hard stools, straining to have bowel movements or needing help to empty the rectum, feeling of a rectal blockage, feeling of incomplete emptying of the stool. Okay, so now we're going to look at some of the causes of constipation. So normally the stool passes through the intestinal tract and rectum through peristalsis. Constipation occurs when there is disruption in the normal movement, causing the stool or waste to become hard and dry, therefore making it difficult to excrete out of the body. The causes of constipation are classified into primary and secondary causes. So now we're going to look at some primary causes. Primary causes of constipations are problems directly affecting the colon and the anorectal function. Normal transit constipation. This form of constipation is also known as functional constipation. It is the most common cause of constipation and is often treated with dietary changes. When high-fiber diet does not help to improve the condition, doctors often do additional tests to identify the exact cause. There is also slow transit constipation, which involves prolonged colonic transit time. It is believed to be associated to a neuromuscular disorder in the colon. This form of constipation is the most common in young women. There is also a defecation disorder, which may include anatomical malformation of the colon or anorectal area leading to constipation. Now we'll look at secondary causes of constipation. Secondary constipation, this refers to other reasons that directly affect the normal process of defecation and stool formation. Drug-causing constipation. Several drugs are known to cause constipation. It is a known side effect for most prescribed and over-the-counter drugs. Some other secondary causes would be neurological disorders. Some conditions are known to cause constipation, such as autonomic neuropathy, diabetes mellitus, and other endocrine disorders. There's also neurogenic bowel dysfunction. This condition is quite common in patients with spinal cord injury, multiple sclerosis, and Parkinson's disease. Now let's talk about some treatments. Diet and lifestyle changes. These important steps belong to the first line of treatment for constipation. Dietary changes, including high-fiber diet, is highly recommended to improve elimination. Proper hydration helps in the process as well as preventing stool from forming dry. Exercising and keeping active will also improve the transmission of waste. Not delaying bowel movements when it arises. Passage of stool may take time, so it's important that patients are given enough time to use the toilet and open their bowels. The next form of treatment would be laxatives. Now, laxatives are medications used to promote smooth transit of stool. Fiber supplements improve the bulk of stool and make them easier to pass. Stimulants, drugs that trigger the intestines to contract. Osmotics, drugs used to promote water movement in the intestines, therefore improving the transmission of stools. Lubricants such as mineral oil allow the stool to pass through the intestines easily. Stool softeners, this draws water to the colon to moisten the stools. And enemas and suppositories. These lubricate the passageway and stimulate bowel movements. Other treatments would be pelvic muscle exercises. Strengthening the pelvic floor is believed to help pass stools. And surgery. In some cases, surgery may be required when the cause of constipation is occlusion or stricture. Now we'll go over just a couple of nursing care plans. There are about 5 or 6 of them on the article on nursestudy.net, so I'll leave a link to this article, or you could just visit nursestudy.net and then just type in constipation and you'll find the article and you'll find more care plans there. This care plan will be for post-surgical care. So the nursing diagnosis would be constipation related to immobility secondary to hip fracture surgery as evidenced by difficulty to pass stool and no bowel movement for 4 days post-surgery. Our desired outcome would be the patient will manage to pass stool in 1 to 2 days. Interventions. Commence a stool chart. Rationale. To monitor the pattern of elimination, including amount and type of stool passed. Intervention. Start a fluid balance chart. Rationale. To monitor the patient's hydration status and identify dehydration as a possible cause of the constipation. Intervention. Commence a food chart. Rationale. Diet post-surgery may be different from a patient's normal eating pattern. Assess the food intake of the patient may help improve elimination. Intervention. Assess mobility and level of physical activity. Rationale. Reduced physical activity can affect paracelsus and promote constipation. Mobility may be difficult in the first days after surgery. Interventions. Encourage a high-fiber diet and oral fluid intake. Rationale. Bowel movements may change post-surgery due to medications given during procedures and immobility. Encouraging the patient to include fiber in the diet when able and to drink plenty of fluids will help ease the constipation. Intervention. Provide time to use the toilet. Rationale. Opening the bowels may be painful in the first few days post-surgery. It is important for patients to be supported and be given adequate time to use the facilities as needed. Intervention. Administer laxatives as prescribed. Rationale. Laxatives are effective in promoting bowel movements. Okay, so now we're going to do another nursing care plan, and this one's going to be for gastrointestinal disorders like diverticulitis. Our nursing diagnosis would be constipation related to inflammatory process of diverticulitis as evidenced by type 1 or 1 to 2 stools on the Bristol stool chart, inability to open bowels in the last 3 days. Now you would need to look at the Bristol stool chart to understand what that is. Type 1 is separate with hard lumps, and that's categorized as severe constipation. And type 2 is lumpy and sausage-like, and that's mild constipation. And for our desired outcome, it would be the patient will be able to reestablish a normal bowel elimination pattern. Interventions. Commence a stool chart. Use a standardized stool assessment tool such as the Bristol stool chart. Rationale. To monitor the patient's bowel pattern. Intervention. Administer laxatives as prescribed. Rationale. To help evacuate stools, the following laxatives can be used as prescribed: stimulant laxatives, stool softeners, especially for the elderly, and bulk laxatives. Intervention. Encourage the patient to increase oral fluid intake as tolerated, ideally at least 2 liters per day. Check first to see if the patient is in any fluid restriction before doing so. Rationale. To help soften the stool and make it easier to pass. Intervention. Encourage physical mobility and exercise as tolerated. Rationale. To increase bowel peristaltic movement. Intervention. Encourage fiber intake of at least 25 grams per day for women and 38 grams per day for men, as recommended by the dietitian. Rationale. To help food move through the intestines. Examples of good dietary fiber include artichokes, carrots, and spinach. This concludes our presentation on constipation and nursing care plans. Please visit us at nursestudy.net, where we have more care plans, practice exams, and study guides. We'll see you at nursestudy.net. This is Nurse Anna saying have a good week.